There's a lot of things that have changed during this COVID period, because we got a lot more interactions with machines, with robotic systems, with online systems. Yeah. So there was a really big step forward, and I think especially robotic systems is something for the future that might give us an opportunity to help sites outside of the range where interventionalists are. Yeah? I think we cover pretty good all over Austria, for example, but Austria is a very small country, and we have a lot of nice places to performing high-end interventional therapy. But still the patient has to come to our hospital. But in the future, if it's possible to let the patient stay in his home hospital, if there is an angio suite and someone, a technician or someone experienced doing these kind of procedures, I think we could develop this method especially for stroke. I think it's maybe not necessary really for aneurysms, but for stroke this could be an advantage, as there will not be more interventionalists maybe. That's exactly the problem. It's a long time that you need to be really good in this field of medicine. You need to have a lot of experience, not to do the procedure. I always say if it's a good device, if it's an easy patient, the monkey can do the procedure. But there is a lot of obstacles that can occur, and to manage the complications, I think, is the real most important part, and that takes a lot of time. And that's why you need more people, but you need to train them. And training is very, very long. And most of the people don't like to be trained that long and not able to perform the easy procedures. They want to do the easy procedure and that's it. But who manages the complication if there is not an experienced one taking over? Imaging, obviously, we got a high standard now, and it's always getting better and better. Selection of patients help us with these imaging techniques to get better in our indications and all. But still, it's my responsibility for the patient. So sometimes it's also depending on the age and the condition of the patient. We don't even look at the images because time goes by so quickly. Yeah? And we just do the procedure, and then you're in the middle of that, and you cannot say, okay, I don't know, I have to look at the images. You just have to go on and not stop the procedure. If you're not experienced, impossible to do that. Yeah? So artificial intelligence helps us in the term of imaging, getting the images quicker to the one who does the treatment. So I get the images from the hospital when I'm at home on call for a stroke, for example. This is very comfortable and very quick, and it speeds up the whole procedure time and even the thing before. Yeah? So when the patient arrives to the hospital, the first images are not even in the whole system. They're on my phone already, and I can prepare for the case and go into the hospital. So this is really a big advantage. In terms of doing the procedures, it might take a little more time that artificial intelligence can learn doing the procedure itself. But that might be a future scenario in the next 20 years, 10 years, I don't know. I'm a fan of these intrasaccular devices because all these medication issues, what we have with the dual antiplatelet therapy of the patients is a whole mess. And I wouldn't say it's a mess, it works properly, and it helps us to use these nice flow diverters, which are a really perfect therapy for sidewall aneurysms. Yeah? One stent, if it's properly performed, patient is good with the dual antiplatelets. It's a perfect therapy that holds forever, I would say. Yeah? But we struggle with these kind of therapies, and if we can have some kind of therapy without need of these medications, it's sure the better one. So that's why I'm really liking the intrasaccular devices for aneurysms, for example, and there is a lot developing now. Yeah?